Beyond the Pelvis is hosted by Dr. Kenael a pelvic floor PT and intuitive healer, and Laura Haraka, a somatic practitioner and breathwork facilitator. Each week, we explore alternative and holistic approaches to healing chronic pelvic pain and other painful or chronic conditions. Join us and other experts in mind, body, and spiritual healing as we discuss a wealth of modalities ranging from ancient practices to modern therapies that challenge the conventional Western model of treatment. Let's get right to it.
So welcome to another episode of Beyond the Pelvis. Today we are so excited to talk to Emily Dufrane. Emily is a licensed therapist specializing in the treatment of complex trauma from a mind, body, spirit community approach. Emily embraces an eclectic and humanistic framework to psychological healing through the combination of emotionally focused therapy, brain spotting, parts work, and the use of plant medicine. Emily counsels from a pro-love, pro-liberation, and pro-self perspective. She believes in dismantling systemic oppressions through interdependence, nonviolence, and the embodiment of authenticity. Welcome to the podcast, Emily.
Oh, thanks so much. It's truly exciting and an honor to be here.
Yes, it's so great to have you. Just to give a little bit of background information, Emily and I met as Vital students. We completed our psychedelic training together over the course of a whole year, and we didn't really connect until the very end because there were quite a few students in the program, but we connected at the very end, and it worked out in the perfect way as it should have. But I was especially excited to speak with Emily because she does incorporate this mind body healing into her work as well as plant medicine. So we share a lot of things in common, a lot more things in common too, but it's nice that we share that in common. But is there anything else you'd want to just like introduce to the audience about maybe who you are on a deeper level and how you got into this space?
Yes, absolutely. I think what is really potent and what I want people to understand about me right now is that just who I am in the context of today is really important. Um, I'm a woman. I'm pansexual. I live in Baltimore, Maryland, and right now I'm a fiance. I'm a daughter. I'm an aunt. Um, I'm understanding a lot more about my family roots and how that's impacted my mind, my body, my spirit, and overall my reconnection to myself. For people who are out there of a similar age, I'm turning 31 in March, and that's very relevant to a lot of what I've come to fruition to in the past couple of years in my own maturity and really looking at myself. So I'm much more than just a therapist in Maryland providing therapy. I'm a human being going through all of this as well, in America right now, which is very interesting. So those are the most important things that I want the viewers to understand. And also in specifics to this podcast, Beyond the Pelvis, my reconnection to my pelvis has been quite a journey, especially in the last few years. I have surgical diagnosis and confirmation of endometriosis, and I have PCOS. It's something that I asked my gynecologist about when I was 14 years old, and it's something that finally people reflected back to me when I was about 28. Not only through my friendships with pelvic floor physical therapists who actually listened to me around my period, but also from the clients who I've worked with. So being in a healing profession has been one of the most profound mirrors and expansions of my life too.
Thank you for
So
sharing
your
that.
own personal journey guided you to be a therapist and work with other people with chronic pain conditions, I'm assuming.
Oh, absolutely. When I look back at some of my first clinical curiosities, as an 18-year-old, as a 19-year-old, and now being a 30-year-old, understanding a bit more of like, well, why did my personality form in the way it did? And what's up with really loving trauma this much? You know, therapy, thera-me is a real it's a real thing. And my entire life from the moment that I was born, from my parents deciding to be together and have a child has influenced my path in a healing profession, has influenced my choices in this, which I think is one of the most chilling things about deciding to work in a healing profession. And I think why a lot of people in 2025, 2024, in the wake of COVID, have started to consider a deeper purpose with their job, with their career, and ultimately how they spend their time. Absolutely. Yeah, big yes.
Now, you mentioned before we started recording that it was working with other clients that sort of helped to reinforce or affirm what you were going through health-wise with your diagnoses. Can you talk a little bit about what you were experiencing as far as with your diagnoses, endometriosis, and I think you mentioned PCOS as well.
Yes, yes, yes. I do have both.
Right.
And a lot of people with uteruses can end up with both, which can be sometimes complicated to sort out. Um, I started having a period in the fifth grade, and it was painful and irregular very early on. So, as an elementary school student, I was really into Discovery Health, super into Animal Planet. So, like, I watched a lot of like birth stuff, gynecological stuff, and I immediately was like, something is amiss with me getting my period this young. And I've watched about hormone things. And that was very weird to know as a fifth grader and later middle school student as I was bleeding through the chair and having significant blood clots and really horrific pain. I sometimes would wake up in the morning vomiting from being in so much pain. And what was confusing was going to the gynecologist at 14 saying, pardon me, I think I have endometriosis. Eighth grade me was a badass and she was smart. She was real smart.
Good for you.
I said, I'm pretty sure I have endometriosis because I'm having all these clots and a lot of pain, and this is abnormal, doctor. And they said, pain is actually quite normal for you. And I said, yeah, but not this much. I was like, I can't go to school. I like school, you know. School gets me out of the house. I really want to go there badly for a
Mhm.
multitude of reasons. I became a nerd for a multitude of reasons. Such a survival strategy, had no idea until, being a bit older. It was then that I was first put on birth control. And so that was kind of a big in a connection to my own intuition. And I have forgiveness for the doctors who truly were not even educated in endometriosis. That's still very relevant to doctors today, which is
Today.
shocking given the amount of human beings who suffer with this diagnosis, especially from such an early age. Um, so that was kind of a big like pause, you know. We can pivot into college and when I started studying psychology, because that's when the clients became more of the mirrors and the lessons. Because I
Okay.
then become very external because when you're told your pain isn't real and what's going on isn't real, you start going like, oh, well, I shouldn't pay attention to this either. And it's pretty horrific. So I have to go to school. And then I started holding a lot of it in my pelvis. Yin yoga is excruciating for me today. I actually did it for an hour before this because I was a little nervous, thought, oh, it's real good for me. I should do that. I did, but I cried through most of it. It's horrifically painful for me. But I know
Mhm.
it will heal me in time. When I started college, I actually starting as a nursing major. I come from an Italian family on my mother's side, French and a lot of Eastern European on my father's side, immigrant family. So even though I'm third generation Italian American on my mother's side, kind of recent, and we've been here a while. And my father's, the immigrant story, being successful, come from a lot of engineers, a lot of doctors. I was really into psychology, but I knew therapists don't make a lot of money. Therapists don't make a lot of money, quote unquote, big quote unquote. That's funny. That was a really big lie. Anyway, that you're gonna work really hard, not make money. It's a charity work. You're not that smart. All these really grossly inaccurate things about psychology, spirituality, sociology, philosophy, all these things, whatever. So I thought, well, I guess I should go to medical school then. And I was thinking about being an orthopedic surgeon. What the fuck? I really liked surgery. I thought it was cool. Don't have a very I had a very strong stomach for that kind of stuff. But then I found out how much it was going to cost and all these things. So I pivoted into nursing, quickly learned that that was a very, very tough career, especially if you didn't really like chemistry, which I did not. I did not like chemistry. It was chemical math, yo. I like feelings and psychology, but luckily I had to take Psych 101. And so it was there that I actually read a textbook pretty flawlessly for the first time in my life. I'm very, very smart, but I have ADHD and I think undiagnosed dyslexia. I'm not sure. I'm not sure. And so, yes, I was very smart, but I had to work like a lot harder than some other kids, to get that A. So when psychology came so natural, I pivoted very hard, very quick. And that has a whole other story too, from some trauma in college. When I started studying psychology, I really immediately went to trauma. I was like, trauma hits everyone. Why is there this delineation between like traumatized people and non? I was still indoctrinated in that old school of thought, which is still present today. I was going to college in 2012, 2013. When that was going on, I started working at an inpatient hospital in an eating disorder unit because it was where I could get a job at the time and walk from campus. It was also ranked sixth in the country for best inpatient hospital. And as a young person, I believed people needed to be somewhere else other than their dysfunctional place in order to really heal. But it was in that inpatient hospital that I learned a lot of things about the dehumanization of human beings in care. And through working with people with anorexia and bulimia and ARFID and complex trauma and seeing their health deteriorate in a hospital, seeing things get worse instead of getting better was really eye-opening. And I also really liked that I was 18, 19, 20 years old and I could read their medical files because I really cared about these people. Some of them have found me later in life, which is pretty special. And it was then that I started being like, wait a second, I'm in therapy school, learning about trauma, PTSD, but all these people with PTSD also have these eating disorders, but then they also have these cognitive things. But then how come their body's responding to this medication this way, but this medication this way? I've always been kind of a Sherlock Holmes person. And I realized pretty early on that health was more like a circle rather than these split disciplines.
So you
And
started to see the mind-body connection.
yeah, pretty much through witnessing human beings going through their own treatment.
Mm.
And I think witnessing was the most powerful teaching tool to me at that time.
And I'm wondering too, you mentioned that you had these conditions and you were kind of, the medical system. It's really hard because I was blown off by the medical system myself because I
Mhm.
had pelvic pain and saying, there's nothing wrong with you. And then I found the mind body connection. And you mentioned you liked school and school gets you out of the house. And you mentioned
Mhm.
survival reasons. So we talk a lot on this podcast about different pelvic conditions, and they are real. No one is
Mhm.
saying they're not. But I'm wondering how much you think your survival responses and needing to get out of the house had an effect on your endometriosis and your other pelvic conditions?
Oh, it is the connection. And I want to say that my perspective of my endometriosis is just mine. It's just mine, you know? And this helps me actually feel empowered and like the endometriosis has been here with me the whole time. Um, yeah. The internalization of trauma is, in my opinion, my endometriosis, my PTSD, my ADHD, my dyslexia, whatever we want to call it, it is. And it's a part of this incredible symbiotic relationship between emotions and the physical body. Um, I know I really love Stan Grof's work about birth trauma and its connection to how people can be later in life. Um, and again, I have respect for every single thing that I've been through and for all of the people in my life who've made me who I am today. But I'm also going to tell some stories, you know, about the reality of things, and it's bathed in forgiveness. It is in forgiveness. Um, but I know that my parents started struggling with their communication pretty violently when my mom was pregnant with me. And I am fascinated about the connection of experiences in the womb and how this begins to set up the nervous system and development. My birth was very traumatic, and I was a normal developing fetus, but when it came time for labor, it was long. And when I began to crown, I was stuck in the birth canal. They tried to use forceps to pull me out. And when they pulled me out long enough, they saw that the umbilical cord was around my neck, shoved me back, which when babies don't go through the birth canal, which to save the mother and the baby, like we love this. I am alive. My mother is alive. I'm very, very lucky. But also like we miss something here. Going through that canal is very important. And yes, I was a very emotional and colicky baby early on. We had an emergency C-section. I came out. That was very lucky. You know, it was some time before my mom could hold me. And that was very impactful. Um, Around me environmentally, I have a half brother who was struggling with drugs really early on. He's 12 years older than me, so there was a big gap there. And that put stress on my parents' connection. It put stress on our home. And he was, I believe, sexually abused. And that was also passed down to me when I was a very young, when I was a toddler. The connection between early childhood sexual abuse and molestation and endometriosis and PCOS is profound. When I've looked at some of the correlative research, I can't spit out numbers in this moment, but I remember reading them as a patient, understanding my own experience and being shocked. You know, it was overwhelming, but at the same time, humbled. Like I was like, wow, I am really not alone in any single piece of this experience because this is so common for children. Um, and it is a painful reality to look at. But from early on, I ate my feelings, you know.
Wow.
And I was speaking in full sentences at 18 months, which is a little creepy, but also amazing. And so I know that I became a little chatterbox, a little Sherlock Holmes, I love to craft. I'm a singer. I like percussion. I'm always doing this. I got a finger thing going during this podcast for sure. Um, I have a lot of interests. I mean, my trauma informs every single piece of that. I'm an adrenaline junkie. I struggled with addiction. I can relate everything back to the beginning and these really pivotal moments for me. And when I heard a lot of the experiences of my clients, and a bit now later on, when I notice some of how they respond to medications or don't respond to medications or certain kinds of exercise and things like that, I'm grateful to be a therapist who can ask, do you like your gynecologist? Have they ever talked to you about pelvic pain? I'm a therapist, so, but if you want a second opinion,
Yeah.
pain's not supposed to happen.
I'm actually curious how many of your clients you found that similar connection. For those who did have chronic pelvic pain specifically, whether it was endometriosis or PCOS,
Hmm.
or just chronic pain, any other pelvic pain, how many of them did you realize had a history of trauma, childhood trauma, whether it was sexual or drug use in the family, or
Hmm.
just birth trauma?
Oh, absolutely. I do not have a patient who has a chronic health condition who does not have early childhood trauma. Every single one of my patients. Now, the trauma is different. And I'm a big Gabor Mate fan. Big
Hmm.
fan.
Yeah.
Big fan of how, I mean, a lot of people are also preaching that same message, but overall, every single one of my clients has an experience of being unseen, underwitnessed, and underappreciated in childhood. And whether that comes from going through a trauma and their parents were unable to help with the integration, which is very objectively complicated. You know, I have a lot of love for parents, especially I'm American, so my lens is around other American parents, and we are spread very thin. And I understand why children fly under the radar. You know, that does not mean that it is not absolutely impactful on their development. And we know this, and we've known this, and we've known this. The way that it impacts our brain development is staunch. And the way that the brain develops relationships with stress and pain and the felt sense of these things and how to ask for help or how to not is formative in the early years and then can become influenced and informed by life. Um, all of my clients have suffered, but I also realize that sometimes this word trauma can be a very hard word. And as, again, a nerd, I've really liked Discovery Health again since I was like 5. I'm numb to it. I'm just like, this is life trauma, boom, boom. And I understand energetically uh, up here that it carries a vibration. And so again, like I just see it as life. But yes, all of my patients with a chronic pain disorder have been through if I think about the ACEs scale,
Yeah.
Hmm.
they all would score quite high. And my um, clientele who have perhaps a more secure upbringing, their ACEs are very low. They rarely have these chronic health conditions unless there has been a major life event later in life that would, of course, be impactful.
Right.
You mentioned forgiveness has been a large part of your work, and it's something that I'm still working on myself. I've made strides, and I just want to make the point for listeners too that parents are doing the best they can. It's their
Exactly.
first time being a parent, and it's about now taking 100% responsibility for our own healing.
Exactly.
So I'm curious because I read your bio and you do work with clients with a modality called brain spotting and along with other things that we're going to talk about. But I just was wondering if you could talk about that and what it is and how it helps people with these chronic conditions.
Absolutely. Absolutely. Thank you for asking. So brain spotting is considered a neurobiological therapy. which means it uses specifically with brain spotting, it uses music and eye movement, bilateral stimulation to create a neurological response in the body that helps it recover from an emotional turmoil, a trauma, a tough memory, like a stuck place in therapy. And what makes brain spotting slightly different than other therapies that might fall under this like neurobiological umbrella, like EMDR therapy or eye movement desensitization and reintegration therapy? Awesome therapy. Awesome therapy. David Grand, who's the creator of brain spotting, actually was an EMDR therapist, and he worked in a practice where, again, witnessing a little tweak in a very awesome thing can change the experience. So spontaneously in EMDR, and I'm not an EMDR therapist, so don't quote me on this, but I've experienced it as a patient. I had EMDR therapy in my 20s, and it was interesting. I had done EMDR with tapping, with vibrators, and also with rapid eye movement. So there's different ways to basically do this whole desensitization reintegration thing. It's very fascinating. David Grand had been working with clients doing the rapid eye movement, and in sessions noticed that sometimes clients would keep their gaze or their eye position in a fixed place in one position. They'd kind of spontaneously stop doing the back and the forth. And as he noticed that people were just kind of doing this, he encouraged people, hey, I noticed that when we try to process X, you keep looking, a little off to the left. Why don't you just keep your eyes there and like see what happens? And again, like a lot of people are very intuitive in these healing professions, which is how new discoveries are made, right? Kind of following an idea. And what David found was that when people would keep their gaze in one position, it would almost like unlock, the stored trauma or memory, almost like you'd hit the filing cabinet on all of this old episodic or memory material, whether it was hard or healing, they are all one and the same. But what he noticed is that people's bodies would start shaking and people would start really emoting, especially in American culture. We're tight up in here, tight. And he noticed that people afterwards would have this big somatic release and then naturally get to this place of like, but I am okay because I went through that. Whoa! And it all of a sudden brought the mind and body into this reconnection after being disconnected for so long. David started following this and kind of whispering to the other EMDR therapists at the clinic. They're being like, we should try this. And so back, I believe that was happening in like the early 2000s, and around 2005 is when brain spotting had really become, this practice that David and his other clinicians followed and developed into more of a protocol. And again, something that I learned. So brain spotting incorporates bilateral music, slightly different than EMDR. I'm going to talk about the difference. Bilateral stimulation means that it's going to go back and forth between the right and the left, either in a felt sense, in an iMovie way, or you hear it. And in brain spotting, we believe, and we've seen through some of the research and some of the clinical experience, and again, I've personally, brain spotting like definitely changed my life, so I'm biased, I'm a groupie, but we see that the bilateral stimulation, meaning it's not just going right and left, back and forth. Bilateral means the music is not in any kind of repetition. It's going to go in and out in the right and left speaker at different volumes, different frequencies, different patterns. So your right and left emotion and logic, grounding and emotionality are constantly activated, but at a low grade. The music's very, very low volume, so that we're stimulating that vagus nerve. We know this vagus nerve has been very impactful for re-regulating the nervous system. And bilateral stimulation also regulates the vagus nerve. So that's why they both work. That's why they both work, right? But bilateral stimulation in brain spotting, we believe, is keeping the vagus nerve in this parasympathetic, recalibrating state throughout the therapy. So what we see on the other end after we've figured out whatever we want to process, and we're listening to music and we find a brain spot, which again is this fixed eye position. I should have brought these closer, but give me 1 second. I have I have this brain spotting basket, you can make it into whatever you want, which is fun. And I really love that it plays with your visual cortex because we are literally playing with your eyes. So sometimes people are into puppets and they'll play in that way, but we find brain spots using a pointer. It's got this from Amazon, a couple years ago. It's just a telescopic pointer, but what we do is bring this close. In brain spotting, we sit knee to knee with someone, so it's so human. And if you believe and feel work with energy, you're in it with somebody. So co-regulation is a must. A brain spotting therapist has to be aware of their own body because if you're jiggering, you're gonna,
So can
spin
you
the
do this
car.
online, this type of therapy,
Absolutely.
or
So yes, and this is a really wonderful question, right? Because you can. I've seen my brain spotting therapist online, but are we limited by the screen? Yes. Can we activate as many brain spots because we're either on a screen? I will not brain spot my clients if they're on a cell phone. It would be a waste of all of our time. It
It's too
must be on
small.
a screen where someone is sitting. The other reality is our visual cortex is very stimulated by these screens, and we know this. So, as a practitioner, I realize that the screens have given human beings access to brain spotting. I'm a queer woman in Maryland. There are some parts of Maryland where if you're gay, you do not have another gay person in miles of you. I've been able to see people on the Eastern Shore who would not have a like-minded person elsewise. So, will I brain spot virtually? Yes. Do we also have to talk about the reality of containment? Because this therapy is expunging trauma from the body. And even if people think, well, I'm doing it virtual, it's going to be like brain spotting light. And it doesn't really matter that my husband who's doing that thing to me is right outside. It's fine. It's fine. It's fine. It is not fine. It is unfine. And we have to work with the reality and find a time where we can have a container. It would be safer to brain spot someone in a car where they can be parked safely, where they can actually like, whoo, after maybe even have a friend in there with them than to be in their home that is unsafe. And this is where I think some personally from going through I'm certified in therapy. I love it. I tell a lot of people to do brain spotting if they're curious about it, and if you're not, leave it. There's a million therapies to try. But as a practitioner who went through both an in-person training and a virtual one, I'm not here to sell anybody on anything, that's for sure. I'm here to tell people if you can get in person, it is quite different. It is absolutely different.
Hmm. That was very detailed. Thank you for explaining that. It sounds and it kept reminding me, and I guess it makes sense why you brought plant medicine work into it because there's such overlap with the integration part and the neurobiology part, because that's what plant medicines do, and then working with the neuroplasticity in order to facilitate healing. So, can you talk about how you bring in plant medicine and how that is just another tool, just like brain spotting is a tool, plant medicine is another tool.
Absolutely, absolutely. Um, as a practitioner, I'm pretty passionate about finding tools that kind of go hand in hand and
Same.
ones that almost in ways mirror each other. And as someone who's had a lot of psychedelic experiences and a lot of brain spotting experiences, they are similar. The overlap between plant medicine that naturally allows people to look at their life in a way that is compassionate rather than with this experience of shame is mirrored in brain spotting, which is bathed in closeness They teach you right away about love and working with your heart. And, in my Brain Spotting 1 training, we talked about shamanism. Like it was perfect. I was full sent in. I was like, this is amazing. And some people who were a bit, had a different background were displeased, and they were not happy about the money that they spent on the training, which I understand.
That's
Uh,
interesting because that happened in my hypnotherapy training too. There was a lot of talk about shamanism and it was very heart centered, very heart focused. So yeah, again, another tool.
Absolutely. In some of my brain spotting sessions where I'm the facilitator for a client or a friend or family member, because again, when you're working in the heart, these boundaries that they don't make sense anymore. And you can hold your own boundaries. So it's like, what? Why wouldn't I help someone who I love? That doesn't make any sense. Um, but my clients who either have had these experiences before or they have not, which then that makes therapy really kind of kind of interesting. But some of them have had past life regression experiences. Some of them they see a guide for the first time, or they see a deceased family member and they feel them. And maybe they've been to church, they've been to prayer, they did that funeral thing, they did the grief journal. But it's different when all of a sudden your consciousness, your regulation, your rest is activated in such a way that your deep spirituality, your lineage, your visual experience, however people want to say it's happening. Um, the combination of brain spotting therapy with plant medicine is very beautiful because even though with brain spotting, there's the music. And Emily, you have smelly stuff and it looks cute in here and like there's puppets sometimes. It is still, again, people's protection mechanisms are on. It doesn't matter if they're like, but I want the brain spotting and I'm here and I'm ready. Sometimes their body is like, I don't trust that readiness that you say. So to re-regulate the system with a safe plant that is in a complete alignment with someone's individuality, not with their diagnosis. I don't work like that. I mean, that is in their individuality, but it's not the only marker, I guess is what I'm trying to say. That's where I think the combination of these things is amazing. And again, I'm a parts work therapist. I love internal family systems. Dick Schwartz was a teacher in the Vital program, which as an IFS nerd, I was like, oh. And he also developed IFS from witnessing teenagers in an eating disorder treatment talk about their parts. And parts is in every religion, it's in shamanism, it's in history, which is why it all repeats itself. So I see it all interconnected, and it's very beautiful to see my clients become open to IFS parts work, plant medicine, brain spotting, and whichever one comes first. Maybe it then directs them to another kind of yoga, acupuncture, going to the gym, saying that thing to their partner. It just starts to move people and change when their emotions aren't stuck in their body and their hips, their pelvis.
I love that all your work connects. And just to kind of summarize it, make sure I have it right for our listeners, basically, plant medicine helps you go into your subconscious, connecting to your heart and looking at life through compassion and treating each part that shows up with compassion.
Um, yeah. You all of a sudden become this really wise grandparent to every experience you've ever had. And whether you've had that really compassionate grandparent, maybe some of us can relate to like grandmother Willow from like the Pocahontas Disney movies, my generation can. We know this archetype. And we oftentimes, I don't care how old we are, we lose that sight of ourselves that we do have the world's pretty nuts and it can be overwhelming and it's also gorgeous. So just like we have to find the beauty in it all. And sometimes our lived experience and makes us feel a lot of shame about the ways we react or respond, rather than like, oh, like that's okay. And you can try again tomorrow. They really allow for that forgiveness. You know, forgiveness isn't this reconciliation. I was raised Catholic. I learned a very weird forgiveness, a very disembodied forgiveness. Forgiveness is actually looking at the raw reality of what's happened and holding its impact with such an intentional cradle that you know, change slowly and gracefully, not in a rush. It's a difficult thing to embody in a time that's demanding a lot of us. And when we do plant medicine, any kind of body-based therapy that allows the body to actually recalibrate, rests, regulate the vagus nerve, believe in yourself, you know, we can change. It's really awesome.
Have you noticed, I mean, I'm sure you have, but what is the like success rate of clients that you've worked with that had chronic conditions where you incorporate all your tools and you notice that they heal from their chronic pain?
Yeah. Yeah. My initial gut response is just like, before I say anything about the rate of change, it is just so hard to trust something foreign. It is so hard to do something that may be legal or illegal. And it's really hard to do something that other licensed professionals have never brought up before. Um, so I just recognize how hard it is to do something. What makes me very sad, but also excited to say, my clients who embrace body facing trauma in a compassionate way that they choose with their agency. So maybe they do that brain spotting plant medicine thing, or like maybe they don't, you know, but something that they choose. And they do it consistently in a way that is sustainable for them and their bodies. They change remarkably quickly. Plant medicine works right away. It works right away. I have endometriosis, I have PCOS. The psychological diagnoses that I do agree with are PTSD. When CPTSD gets recognized in the DSM, you check one, please, and ADHD and OCD. And when I take medicine to regulate those things, whether that is in a microdosed way, a regimented way, or whether that is in a sacrament way, like in ceremony, the results are immediate. My endometriosis can make me cry sometimes and immediately wake up and I'm just like, ah. And within 30 minutes, 45 minutes of a microdose, if I'm fasting, I'm like, nice. And it radiates away. My clients are having the same experience, and that can be very beautifully painful. So,
Do you have clients that are afraid to take the plant medicine? And
oh
I'm
my
just curious, what do you
God.
say to them?
Yeah, of course, of course. Um, I mean, I couldn't bathe that fear in more normalcy, and humanity. The biggest part of working with any kind of change, I mean, plant medicine is going to change your consciousness, which, I mean, anything we put in our body kind of does, but this has a war on drugs movement behind it. So the fear is historical for us. And also we're seeing like it's not legal everywhere. This is risky for people. Um, we do not move forward until that fear is on board and regulated. From a brain spotting, from a parts work, from a psychedelic approach, that part needs agency in this. You know, when an emotion comes up and says, I'm scared to do this, that's an automatic sign of like, well, we certainly are going to make space for the fear and not move forward. I think people need to understand that they can do scary things and they're allowed to take their time. And that pacing can be at the end of the conversation. It can be 6 weeks from them. Again, that preparation and integration, that's medicine work, patience. And humans need to understand that when they feel scared, they gotta love that back a bit until it's so dialed down that even the fear is saying, I'm ready for the medicine. I'm scared, but I'm ready. If it's saying I'm scared, I don't want to do this, well, that's enough consent for me. And I understand that from some things that are happening in psychedelic and spiritual spaces, consent and agency is not bathed in every practitioner's value system. And so I really encourage people to check in with themselves about what makes them feel safe with another guide. Because if there's a push and a rush, if you don't know what you're taking, or you're uncertain of the dosing, or you're uncertain of their credential, whatever you want to know, they have a right to ask. So fear is a really informative emotion, and it's a big pause, but also, we sit in it. We don't have to run from the fear, but we pace with her or him or them very intentionally. Um, and I do not know a client who's coming to something for the first time, especially brain spotting or plants, and isn't scared or anxious. I was so weirded out when I went to the brain spotting training, which was I'd read about it 2 weeks before and was just like, oh, I'm gonna get trained in it. I had no idea, and it rocked me. Oh yeah, oh yeah, it was a time. So uh, I understand what my clients are feeling. I too felt it and still feel it. Anytime you're gonna face a trauma, the body's like, no, please, no, please. So yeah, it just happens.
Mm. Can you talk about where you are now as far as your diagnoses? Like where are you now compared to where you were?
Oh my gosh. Where have I been with these? I mean, now I'm just so proud. I sleep regularly. My pain is minimal, and when I feel it, I know exactly what to do. Um, One of something that I am excited to talk about was my work with a nurse practitioner. Her name's Sylvia Hazel. She changed my life and actually told me about a really fascinating research study in autoimmune and anti-inflammatory science with naltrexone that I'd never heard about as a therapist. So currently, I am on the least amount of medication I've ever been on, and I'm feeling the best. Same token, I'm on medication and I'm on supplements, and I have to take really good care of myself in order to feel this well. And that was quite a journey. For me personally, I don't drink alcohol anymore. Um, I had to give up a lot of recreational use, and I use low doses of psychedelics regularly. And I do the Stammet Stack, which is an autoimmune and anti-inflammatory regimen with lion's mane and niacin. I do hot yoga. Every day is what's best for me. It's usually 3 to 5. And I want that to keep increasing. That's a goal. That's a 2025 Emily goal. Um, I have to be really honest about my emotions. I have to hold my boundaries very, 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 very underline well. And that's still something I'm working on as a person. Chronic people pleaser, fawner, again, very common things in a dysregulated nervous system. So I think the naltrexone will help me with that, but I'm still getting to the full dose of that. Um, I'm still figuring out if I like all the medications I'm on, but I am the best I've ever been. But holy shit, I've had to change a lot. Past 3 years have been immense. That's when I had excision surgery and got a lot of confirmation.
I really appreciate, your vulnerability and your honesty, sharing all that because, the three of us, help people all the time, but we're all on a journey and it can take a lot of effort to keep our health. I only know what I do as a person, and I know a little bit since Kenael and myself are friends, what she does to take care of herself. And it's so important to take care of ourselves, and it is so worth it. So I do really appreciate you telling our audience all the things you've went through and what you do to take care of yourself, because it's not so easy sometimes, and we have to incorporate all our tools as well. So I was kind of wondering if there was one bit of advice or one tip that you would like to leave our listeners with today. What would that be? And I know you've shared so many good tips.
I came in really excited to say stuff today. I mean, my biggest tip is just don't stop and take your time. Don't stop, but take your time. We're coming into a period where things are going to feel really heavy. And so we have to take breaks. And also, don't disconnect from this thing, because if your body's giving you a signal, it wants you to listen and take your time. One of my clients' mantras is go forward gently and strong.
And by don't stop listening, you mean your body, right? Don't stop listening to your body or your heart.
Your body, your heart, your mind, they're all important signals. Just don't get too caught up in the stories.
Right.
The stories are the mind stories are manifestations of a body's signal. That body tells the mind something several seconds before the mind has a story to spit at you. So my biggest encourager to people is, if your mind's going, drop into your heart. They usually have the right way to go.
Thank you for that. And can you share where people can connect with you if they want to reach out?
Oh, absolutely. Thank you for asking that. Well, I practice in Baltimore, Maryland, and I'm licensed in the entire state of Maryland, and I'm happy to talk to anyone, anytime, especially if they need information about brain spotting or plant medicine and how to connect with a provider who is licensed in their state. It's best to connect with me over email, and you can email me directly at hello@sacredcrowcc.com. You can also go to my website, which is www.sacredcrowcc.com, and I'm Sacred Crow Counseling on Instagram too. We can connect in whatever way makes sense, and we'll move to what is confidential and appropriate from there. Thank you.
It was such a pleasure to have you on the podcast today. And for me, just to learn all these different modalities and to share with our listeners, we really appreciate your guidance and your vulnerability today.
Thank you. Thank you so much for listening.
Thank you. I feel like we could have talked a whole lot more, so we'll just have to have you back.
Thank you. I'd love to be back.
Yes, thank you so much.
If you'd like to leave us a message or ask a question, please check the show notes with the link so you can reach us directly, or email us at beyondthepelvis@gmail.com.